Well, thank you very much and good morning to everybody. This is Flashpoint, the voice of national unity, and I'm David Cote. As usual, I have medical doctors here from different disciplines, different medical institutions, and today is no exception. I have in studio three distinguished personalities, medical practitioners from the JFK Eye Center. They are here today to talk about very serious matter. It's called cornea. We don't discuss that most of the time in Nigeria. We discuss glaucoma and cataract here mostly, but glaucoma is another major issue when it comes to the eye. And so today I have in studio three doctors from the JFK Eye Center. Dr. Merle Fernandes, sitting right by me, a lady from India who grew up in Kenya. Do I have the permission to say that?
Yes, you
All right, all right. And you're going to tell that from her English. And then we also have Dr. Uh, Bashik Katia.
Yeah.
Yeah, he's
Hello.
also from India.
Hello.
Yeah, he's a cornea surgeon. And I forgot to say that Dr. Mel Fernandes is a cornea, cataract, and refractive surgeon. They will tell you more about themselves. Then at the far right there, he's no stranger here. We have Dr. Caleb Patrick Wood. He was here before to talk about cataract and cornea. I mean, not cornea, I'm sorry, cataract and glaucoma. Today he's here for the second time. So welcome to Liberia.
Thank you,
And
Mr. Howard.
welcome to Flashpoint.
Thank you.
Thank you.
Let's begin with you, Dr. Fernandez. Tell us a little bit about yourself, just briefly, in about 30 seconds.
Sure.
Yeah.
So I'm Merle Fernandes, and I was born in Kenya, so I'm an African at heart.
Okay.
And I've studied in India, done my medical training, ophthalmology training, fellowship training in cornea in India, and I currently work at the L.V. Prasad Eye Institute as a corneal surgeon. My specialty in that area is in pediatric cornea, and I'm also the director of the Kalamanji Reddy campus in Hyderabad, in charge of finance for the network, as well as the Green LVPI Sustainability Initiative for the institute.
Very impressive pedigree. Before I go to Dr. Katia, I want to inform the public that this program is on Facebook. You can please go to the David Cote page. It's Kortie, David Cote page. And you can please share the show. Watch this program on the page where we have 6,400 views already. And then by the end of the day, it's going to be on YouTube where you can watch it anytime. Your introduction, please. Just
Yeah.
30 seconds.
So, hello everyone. I am Abhishek Katiyar, and I am from northern part of India, from the state called Uttar Pradesh, and from the city called Devariya. So, I did my education from there, and then I did my ophthalmology training from Uttar Pradesh itself, and currently I am at L.V. Prasad Eye Institute as a cornea fellow, and currently we are working for eliminating the cornea blindness.
Okay.
Yeah.
Fighting to eliminate cornea
Blindness.
No.
Blindness.
Okay, thank you. Now, Dr. Wu, the man who is used to this home. Go ahead, sir.
So I'm Dr. Caleb Patrick Wulu, Liberian born and raised, and I got my medical education from A.M. Dokleati College of Medicine, the only medical school in Liberia. And recently I've written my exit examination. So in the next maybe 3 months, I will be a specialist ophthalmologist, and I'm happy to be here.
Thank you. And you are also a citizen of India by affiliation.
Yeah, sure.
Yes. Thank you. Okay, let's begin by coming to Dr. Fernandez by asking her to tell us what cornea really is. What is cornea, madam?
So when you think of the eye, you can see that there's a front black part, and then around that there's a white part. So the cornea is actually that front black part, which is a transparent layer in the front of the eye. And it's more like, when you imagine the eye as a camera, the front lens that allows the light to enter the camera, the old camera, not the current cameras that we have.
I know.
Yeah. So that front transparent layer is actually what the cornea is. And so if there's any damage to it, it becomes opaque, either by an injury or by infection, or from birth it may be white. And when it's white, it doesn't allow the light to enter the eye, and that's what we call corneal blindness.
Okay. Now, I'm a little confused. What's the difference then between cornea and cataract? I know cornea causes blindness. I mean, cataract causes blindness. But normally, when I see the part of the eye, I normally call it the cataract. Because, please explain to me, sir.
Yeah. So cornea is actually the front part of the eye
Yeah.
that is transparent and that allows the light to enter the eye. The cataract is actually the opacification of the lens.
Okay.
Yeah. So there is in all our eyes there is a lens inside our eye. So the cornea and the lens, they together are the refractive things in the eye. Okay. So cataract is something that is inside the eye, that occurs opacification of the lens that is inside the eye. So that is a age-related process mostly, but cornea is different thing. Cornea is the front part of the eye.
Oh, I see. That
Yeah.
clear lens that can be clouded or opaque later
Yeah.
on.
Yeah.
And you call it cataract.
Yes.
Yes.
Oh, I see. All right. Then uh what are some common corneal diseases in Liberia? If you can, because you have been here 1 or 2 times.
Yeah.
Yeah.
So I think so essentially when you look at what percentage of corneal pathology causes blindness in Africa per se, it's around 25% of people would have a corneal pathology, which is a kind of affecting their vision. And when you look at common causes, it's mostly occurring due to trauma, so
Okay.
some kind of an injury, and the second could be an infection. So there's an infection of the cornea that also makes it opaque. Very rare instances of abnormalities in the corneal shape. So the shape is abnormal, or if a child or a baby is born with a white cornea, so we have an abnormality from birth, and sometimes because of say chemical injury or something that's instilled into the eyes that makes the cornea white, that can also cause corneal blindness.
Okay, 2 questions quickly. Sometimes we see some people, the cornea, the front part of the eye is totally white.
Yeah.
Is that, do you call that the result of, it's a cataract?
No.
Okay.
So if you imagine your watch,
Uh-huh.
okay?
Yeah.
So you can see your watch, which has a glass dial on top,
Right.
But the entire mechanism of the watch is inside
It's
it.
inside, yes.
So if you imagine the transparent glass on top,
Mhm.
that's what the cornea is.
Okay.
And everything else that's behind it, the mechanism, like the lens, the retina, it's all the inside part of the eye.
I see.
So that's how it is essentially.
Thank you. Let me say one more question for you before I go there. You talk about trauma.
Yeah.
Then what happens to these people who are boxers? Hitting the eye. And
Yeah.
does that really cause cataract after?
It can cause a lot of problems. It can cause problems right from the front of the eye, right to the back of the eye. So the front of the eye can get affected when you have redness on the white part of the eye because of some external bleeding that has happened. There could be swelling of the eyelids. The eyelid could become black, something we call as a black eye.
Yeah.
So that's one of the external injuries. Inside the eye, there could be bleeding that could happen. The lens can become cataractous over time. The retina could detach. There could be bleeding in front of the retina, or the nerve could also get damaged. So these are all things that boxing as a contact sport can have on the eye.
Okay, if that's the case, let me come to you, Dr. Bashik. I gotta get used to your name. What is the remedy for a cornea disease?
So most of the cornea blindness that we see today, most of them are preventable, like infection. Because what analysis we have done in our OPD, most of the patients are like if they face trauma, then they use some traditional eye medicines, and then it rather than relieving, it
It makes it
aggravates
worse.
it. Yeah, it makes it worse exactly, and till the time the patient is using that traditional eye medicine, it delays the presentation to OPD also. So all these, most of them are preventable. Also, one of the most common cause that we see in our country is vitamin A deficiency, but because of the vaccination, it has become less. Then, so most of these are, except for the genetic diseases and the inherited diseases, most of these diseases are preventable. So there should be a proper awareness about this. The patient should not buy the drops from the local pharmacy. the patient should consult a eye clinic or eye
Yeah.
specialist in any problem.
Yeah.
Especially if he sees some whiteness on the black part of his eye, he should come to eye clinic rather than using a traditional medicine or rather than using the medicines from the pharmacy.
Okay. Dr. Blue, you
Yes.
just listened to Dr. Rashid talking about self-medication. People want to treat themselves. You're not a medical doctor.
Sure.
Now, something is wrong with the eye, you advise yourself and you take your own medicine. It maybe eye drops, maybe the eye drop you take is not for that particular purpose, or traditional medicine. What advice do you have to give the public when it comes to self-medication?
So I think it's extremely important we tell the public that having inadequate medical knowledge and using it to your own disposal is
Yeah.
very wrong. So most of the time, even in homes that you have educated people, people tend not to go to the hospital and just go ahead and use medication. Self-medication is bad. We should all seek a proper care because that's the reason why those people who go to school to give the care are there. So I think it's wrong, and the public should know that you should always seek a proper care, especially for eye care. You should always seek a proper care so that you can be caught up in a situation where you make matter worse instead of getting better.
What do you also have to say to medical doctors who are not ophthalmologists? Because I have gotten complaints.
Yeah.
I host people here, and I sometimes get calls from people, like from Kipma County. I got a call one time where a doctor in Grand Kipma County destroyed somebody's eye further by treating it. So what do you have to say to somebody who is, for example, a gynecologist? Your area is about ladies, about women. You don't know anything about eye, but you want to treat somebody because you are the only doctor in that area. What do you say to people like that?
So I want to say to my colleagues, right?
Mm-hmm.
They say a good doctor is the one who makes a timely referral.
A referral.
Yes, that's a good doctor.
Please make that clear. So that there are some market people who have not been to school. What do you mean by referral?
So in the layman term, a good doctor is the one who sent a patient to a particular person who knows how to do that job.
Right.
That's a good doctor.
Yes.
And even me personally, a lot of times my family or my friends will say, "Oh, you're a doctor, so you do this." No, I always tell them that if you have this problem and I feel like it's not in my particular line of work or my field,
yeah,
I could find somebody who will give you the best care.
That's right.
Say for instance, my mother, she wants to do her surgery in October of this year, and then she asked me about it. So I was like, I've just become a specialist now, but you can still come, and then I will talk to the professor, Dr. Niranjan, and then he can do your surgery because I know he will give you the best care. Right. So that's what a good doctor does.
That's what a good doctor
Yeah.
does. I like that. Dr. Bashir, I come back to you. What is eye donation? We have heard about eye donation. Can people really donate their eyes?
Yeah, so first of all, the terminology is itself not correct. It's cornea donation.
All right.
Yeah, so I cannot be donated. Only the cornea, the cornea that is the front part of the eye. Only that is we take it from another person, and then we transplant it to the person who is a cornea blind.
Yeah.
Okay, so that person who can get good vision, but he is cornea blind, so that person his cornea can be replaced with the good part, good cornea. This is all the good cornea transplantation.
Right, it's not eye donation, but cornea donation.
Yeah.
Still on the cornea donation, do you get the donated cornea from a dead person or from a living person? How do you?
Yeah. So no. So cornea cannot be taken from a living person. No. But if after the person dies, so his cornea, we say it's alive for at least 6 hours. Okay. So till that is a time period in which we can harvest the cornea from that person, and see if the person has died, his both corneas can be given to a person who is cornea blind. So one person can benefit 2 patients.
Oh yes.
Yeah.
Yes. Yeah, because once that person is dead, the 2 corneas from the 2 eyes got to be removed.
Yes, and we can give sight to 2 patients who are cornea blind.
All right. Now coming to you, Dr. Fernandes, we have heard about eye bank. What is eye bank, and what do you save in that bank?
Yeah, so it doesn't give you money for sure.
Pardon?
It's not a bank for money.
Oh, okay.
But so an eye bank actually is it's a place where you can have corneas that are harvested,
Mhm.
they are stored, they're evaluated,
Hmm.
they're processed, and then they're distributed to corneal surgeons for surgeries in corneal blind people. That, in essence,
Mhm.
is what an eye bank does.
Okay.
So the personnel of the eye bank would be involved in counseling relatives of somebody who has passed away,
Yeah.
to talk to them and tell them about what is the importance of donating the cornea. Once that cornea once they accept to donate, they give their consent, and it's an informed written consent that we take from the relatives of a deceased person. The trained personnel would then harvest that cornea, which is just the corneoscleral rim, just a button of the
Yeah,
eye
yeah.
that is taken out, and that is stored in a specific medium which will keep it alive, keep it functioning,
For
keep
how
it
long?
viable. So it depends on the type of medium that's available.
Okay.
So back in India, we have two types of media that are available. One is for up to 96 hours, and the other is up to 14 days, which gives you enough time for contacting patients who have a corneal pathology and who have a corneal problem to get them into the clinic so that you can get the surgery done. And so once the tissue is harvested, then it has to be processed. So we'll evaluate the tissue, make sure that it is suitable for use.
Mhm.
Sometimes you have situations where the donor has got some kind of an infection or some other problem, and we're not able to use that cornea, because the key thing that you do when you transplant a cornea is you should not cause a problem in the recipient. And there are certain diseases or certain infections which could be transmitted from the donor to the recipient. So the entire process of that evaluation and harvesting ensures that the cornea is absolutely safe for use in a person who has got corneal blindness. So that job or that process of evaluating it, processing it, and then distributing it and making sure that it falls into the right hands of a trained surgeon
Right.
is what the eye bank does.
Okay. Now, still on you, Dr. Fernandes, what do you say to people who are afraid of dead bodies, including me? A dead person, to get that cornea from a dead person to another person who is afraid of dead bodies, what can you say to them? And number two, if that cornea from the dead person is passed on to a living person, how long does it stay? Like, for example, I have two new lenses in my eyes. Dr. Naraja Perry removed my cataract and replaced them with new lenses. They are there forever. How long does the cornea remain in the eye of that person from a dead body to that person?
So I don't think we should see when you die,
Mhm.
essentially your soul has gone to heaven,
Mhm.
right?
I like that.
Right. So and I think that if a part of your body is being used to give somebody else life
Right.
or sight,
Yeah.
I think that is one of the most noble gifts that, or a legacy that a dead person can leave behind.
Yeah.
Right.
Yeah.
So I think from the perspective of the family of the deceased individuals, they always know that in donating the corneas, somebody else is going to be seeing the world through their relatives' eyes. And I think that's something that is so powerful that it's a movement that we can start in Liberia as well,
Mhm.
right? And it's even in India, it took a long time for us to reach the level that we are at now as
Right.
far as corneal transplantation, eye donation is concerned.
Mhm.
We're slowly moving from that, because this is from a deceased individual,
Yeah.
to getting other organs donated as well. And so we've not reached where the US is, where everybody mandatorily is a donor. As long as you get a driving license, you have a driving license, it says on your license you want to donate your organs. So if you're brain dead, you can donate your organs.
Hmm.
So we've not reached that stage, but we're getting there. And I think the small start that we can make in this country is, once somebody has passed away, they can donate the corneas so that they can be of use to somebody else so they can see.
If that's the case, we haven't reached there yet, and I hope we get there. What advice do you have to give the Liberian government? What do you have to say to the government in order to start something like this and keep it? But before you answer that, the program we follow is Flashpoint on ELBC 99.9, and I'm David Cote, the host. I have in studio today three very distinguished medical practitioners. Dr. Merle Fernandes, a cornea, cataract, and refractive surgeon. She's a lady from India, which was born in Kenya. And we have also Dr.
Abhishek.
Abhishek. He doesn't want me to mix it up again. Dr. Abhishek Katia. He's also from India. He's a cornea surgeon.
Hello.
And also Dr. Caleb Patrick Wu. That's for him. This is his home. He's been here before, and he's here again. So, what do you have to say to the Liberian government in order to start something like this?
Yeah, so I think it's important that the government understands the need for such a program. And as a first step, I think we require all the important stakeholders.
Mhm.
So it has to be the Liberian government, the Ministry of Health, people from the JFK, the legislative bodies, everybody, the legal cell, everybody has to get together and create those laws that enable us to start this kind of a program here in Liberia.
Mhm.
So initially, when we started off in India, it was kind of more of a voluntary process where we would call up individuals when we heard that there was a death in the family, counsel them and then get the corneas. Gradually, that has moved to something known as the Hospital Cornea Retrieval Program, where we have our team of counselors stationed in the hospitals. And when somebody passes away, the team moves in and talks to counsels the relatives of the deceased, and that's the hospital cornea retrieval program. So essentially, the difference between these two is when you have a voluntary donation, it's usually somebody who's very old who has passed away, somebody who's in their 80s or 90s. While in the hospital, when somebody passes away, it may be a younger individual, maybe tragically passed away in a road accident, or maybe a heart attack at young age. And so the kind of cornea that you get from these younger individuals who pass away in hospitals, where the entire workup is done, the entire background of the patient, of the cornea that you're collecting. So that entire background is already available in a hospital,
Right.
as opposed to a voluntary donation from somebody's house.
Yeah.
So that makes the job a lot easier
Yeah.
in terms of the quality of the kind of tissue that you're getting, which
Yes.
means that the ultimate outcome of the corneal surgery is going to be much better when you have a hospital cornea retrieval program in place, as opposed to voluntary, and that's a much slower process as well. So I think if everybody gets together and creates the legislation for us to start harvesting corneas in Liberia, as the next step is this is already the first step where we're creating
The
the
first
awareness.
awareness, yes.
The first step is the awareness for the people, and then the legislation to set things in place. Then we are slowly on the track to setting up the eye bank and taking it from there.
Thank you. Mr. Blue, you are in Liberia. You're already here. What advice or what steps have you taken already as a doctor at the JFK? But Dr. Fernandes, I'd like to say here today, as a former lawmaker in this country, I'm going to take some steps. I have some very good friends there. The first time I heard about this bank was when Dr. Perry was here. He talked about it. And he said there were some things we were trying to start. I'm a former member of the parliament or legislature. So I think I'm going to start something.
Yeah.
Talk to
Thank
some
you.
friends. Yes.
That'd be very good.
Yeah, I'm a very close friend of the Speaker of the House. In fact, let me also say here that he's one of my former students. I tell him way back. So I'm going to start with him and start with other friends there to tell them how important this is so that we can start doing something about it. You are here. What has happened so far as a Liberian doctor at the GFQ? Have you started something already about this eye bank?
Okay, so it's a new process, it's a new thing that we've just started talking about. Yeah, so not it's not like we all the way like started engaging people about it. It's like an in-house thing right now. We have started to talk to people in the hospital. I had you were in the grand rounds meeting the other day, right?
Right.
Yeah, so we have started having conversations about it in grand rounds. I think the most important thing is for us doctors to be able to have a clearer picture of what we want to do first, starting from the hospital. And then the hospital is a community. And then from that community, we can go out to our own smaller communities and then engage other people and tell them about cornea donation or the need for our bank to be in Liberia. Because quite recently, Dr. Fernandes visited and she have done like over 11 surgeries, man.
11 transplants.
Yeah, 11 transplants. And all of those tissues came from somewhere else.
Yeah. I must say it's very expensive.
Exactly.
Coming from somewhere else.
Exactly. So if we have, it's not like a luxury. If we have the need for that and we have the ability to create, I think we should be able to open up the opportunity and go ahead and do it instead of always getting things from outside Liberia. And it's very hard to even get them from outside Liberia. So most times when they come like a luxury goods.
Yeah.
So if we are able, if we are able to help in the process, and the help will not even be, it will just be little or nothing. I think we should go that way. That's what I think.
But don't you think if some arrangement is made with the legislature, where you, when I say you, the JFK, can appear to explain why it is important and necessary? Don't you think that could be another way to? You have started the first way by doing the awareness. As I said, Dr. Perry was here one time. He talked about it, and I haven't heard anything about it since then. This is the second time we're talking about this bank.
Sure.
Don't you think your appearance before the legislature is possible? The arrangement can be made for you to go and let them better understand why this bank is necessary.
Sure. I think it's extremely important. And then at the end of the day, when these things happen, it has to be passed into law.
Yes.
Yes. So when it's passed into law, then it's legal. It's not something that's done on the side. And then people will understand that it's actually a legal process and it's not somebody trying to trick them into something else. So at the end of the day, the ultimate goal is for us to be able to create a pathway, meet the legislature or the stakeholders, and then have one voice explaining to them simply what we want. And then from there, I mean, if we paint a perfect picture, it's clear that they will be able to understand. And hopefully it can be passed into law, and then we can move on from there.
Thank you. That is where we come in. We're going to do our part. The program is Flashpoint. We're about to take some calls just in about 2 minutes. Those of you who listen all the time, you know the format here already. It's a 1 hour program, 30 minutes for discussion, 15 minutes for you, the participants out there. Then we come back to our guests for. But before we go to the radio, and let me inform you, if you're out there, you want to take part, it's 0777 511 977. That's what you're going to call when the time comes. 0777 511 977 and 0886 511 977. Before we take the break, what did we not mention that you'd like to say before we can? Let's start with you, Dr. Fernandes. Is there anything I didn't ask you that you'd like to come the topic about?
So I think earlier Caleb brought up a very important. Caleb and Abhishek, both of them brought up a very important point about prevention.
Okay.
And I think that is something that we should all work towards, because that's another thing that we need to create awareness about.
Yes.
How to prevent certain eye diseases, and avoiding the use of indigenous or traditional medicines, which can kind of worsen the situation. So I think that's another aspect that we need to cover. Probably not in this particular radio show, but going forward, maybe talking about the different kind of problems that we see, which could easily be prevented.
Yes. And let me ask a question now. Are there any signs and symptoms? Are there any signs and symptoms to show that you have cornea problem? So that when these things are happening, then we say, okay, we know that cornea is coming to do something about. What are the signs and symptoms? Let's come to you, sir.
Okay. So if a person is suspected that he has a sign or symptom, so he can suspect it if there is the white part of the eye, if it goes red, or the black part of the eye, if he can see some white spot on it, so that means he's likely that he has a cornea problem. Other than that, the cornea is the most sensitive organ. So the person, if he is feeling pain, so he must visit our eye clinic. rather than buying drops by himself or using some medicines or consulting someone else. He should visit an eye clinic so that his proper corneal examination is done and adequate medicines are prescribed.
Dr. Wu, what I want you to do now is to tell the public, Dr. Wu, please tell the public about eye drops. You know, sometimes you find a person who is like, in my case, for the past 9 years, I have been using eye drops
Okay.
for glaucoma, which is pressure in the eye.
Yeah.
When you were here the other day, you informed us that even if your pressure is not high, it should be between 10 and 20 millimeters. Even if it is not high, you can still have glaucoma. You told us that.
Yes.
What advice do you have to give to me, who's taking my glaucoma eye drop, and I see somebody's eye red, and I just say, come, try take this eye drop. What advice do you have for people like us who just take any eye drop without going to the hospital for proper check?
So I think it's wrong. So just self-medicate or use any eye drop. Most times people do that at home. It's wrong. Everybody should use the drug that is prescribed for them.
Yeah.
Even if you have the same problem as somebody else, sometimes the doctors, even when they prescribe a drug, everybody have their duration, the dosage, how it should be used. Your problem, we can have the same problem, but mine could be worse than yours. So the best thing is to go to the hospital, get examined, and then get prescribed medication for your problem.
Yeah.
That's the best thing.
Right.
Instead of just using somebody's eye drop or putting something
And you
in
know
your
the main purpose of that eye drop.
Sure.
Well, it's the same as people who feel feverish and they just go to the hospital, this OTC tablet. Just go to the hospital and say, I'm feeling cold. I think I got malaria. I want malaria tablet. It's very wrong.
No.
You need to do the diagnosis. You need to do the test at a hospital with a qualified and competent doctor before you can take any medicine from the drugstore. Because when you feel feverish, it could be because of malaria or typhoid. Now, when you keep sitting there and taking malaria medicine, the typhoid is still there. It will kill you. Be very careful. We'll take a short break. And when we come back, the numbers to call to participate will be 0777 511 977 or 0886 511 977. Let's take a short break.